Alright, so I'm going to start us out just kind of laying a roadmap of some things that we want to accomplish by the end of this presentation. So by the end of this webinar, you'll be able to gain awareness of the mission and the scope of the Ohio Department of Developmental Disabilities, as well as identify health-related challenges faced by Ohioans with developmental disabilities living in rural counties, and describe how staff instability affects DODD service system, and also discuss strategies to address staff instability in the DODD service system. So we're going to start out by covering what exactly is a developmental disability. So developmental disability is a severe or chronic disability that presents in an individual before the age of 22 and is likely to persist indefinitely. A developmental disability can be attributed to a mental or physical impairment and relates to daily life skills. And some examples include autism, cerebral palsy, Down syndrome, Fragile X syndrome, or spinal bifida. So to give you a better picture of who DODD is as an organization, DODD is a state agency that offers supports across the lifespans to individuals with developmental disabilities as well as their families. And this is done by overseeing a statewide system of services that assures health and safety, supports access to community integration, and increases opportunities for meaningful employment. And so the goal of these efforts are to improve quality of life for individuals and their families so that they experience a lifestyle of opportunity. So we're going to show you a quick video that gives an oversight and a better picture of how the Ohio Department of Developmental Disabilities works.
So, you have some questions about developmental disability services in Ohio? You've come to the right place. We'll cover the basics and tell you where you can find even more information. The Ohio Department of Developmental Disabilities oversees a statewide system of supports and services for more than 95,000 Ohioans with developmental disabilities and their families. Anyone with a developmental disability that is a severe chronic disability caused by a mental or physical impairment that is present before age 22, likely to continue indefinitely, and cause someone to need special care, treatment, or services can be eligible. The support that each person receives is based on their needs. Support can be things like help with daily living needs and personal care, support and training to explore different jobs, help getting to work or getting out into the community. Your local county board of developmental disabilities is the best place to start. They can guide you through eligibility requirements and let you know which services or what local resources are available to you. Then you decide what services fit you best. Your county board can also help you find service providers, the people who provide the services outlined in your plan. These may be people who work for other community services, volunteers, or people who are licensed or certified by DODD. Your county board can also help you find local services and supports. Most services are available at home, whether you are living on your own, living with family, with a roommate, or with somebody paid to provide full-time care. For some people, services can also be provided in a facility, like an intermediate care facility or a developmental center focused on providing a bundle of services in one place with 24/7 access to emergency care. Your county board can let you know what options are available for accessing support. Then you can make the choices that fit you best. Click the map to find your County Board of Developmental Disabilities. Ready to learn more about services, service plans, and providers? Click the links on your screen.
Alright, so now we have a good picture of county operations. So now we're going to go into some of the services that are provided. So first we're going to cover home and community-based waivers. So waivers are one way individuals can obtain the services they want and need while remaining in the community. And through Medicaid's funding of this, it helps them pay for these services. And so there's 3 waivers that are designed to best meet the needs of individuals, and they help cover services such as homemaker personal care, adult day and employment services, transportation, and home modification. And so these 3 waivers are the individual options waiver, which is the most comprehensive of the 3, and allows individuals to live in the community with reliance on paid supports. And you see that we have about 23,000 individuals taking advantage of that. Next is level 1, which supports the waiver's reliance on natural supports, and there's about 15,000 people on that waiver. And the self-waiver, which is the self-empowered life funding waiver, is a newer waiver, so there's only 1,700 people on that waiver at this time, and it's Ohio's first participant-directed waiver. In addition, so we have state-ran developmental centers, and this is another way that DODD provides services and coordination of care for individuals residing in ICFs. And so as part of these efforts, Ohio has 8 developmental centers that are located in different regions of Ohio and operated by the states. And so currently there's about 662 people living in developmental centers. 12% of these people are there by court order, and 21% are there for a short term. And here they provide comprehensive medical and behavioral and residential care with the goal of increasing capabilities and independence. And they're also utilized for temporary residential placement and short-term stabilization. And the goal of this is community reintegration. So there are plans put in place to help make the transition out of DCs better for the individual, and this happens in the form of exit and conversion waivers, as well as community capital assistance programs. So staying in the same mindset, developmental centers are ICFs, and so similarly there are several licensed ICFs throughout the state, and this map shows where they are and the size of these ICFs. And in ICFs, individuals with a disability can choose to live there, which is staffed 24/7, and aids in helping them live a better life. And the provider at the ICF is responsible for all aspects of care for the individuals. So next we're going to touch on some strategic initiatives and programs that are designed to help increase the quality of life, autonomy, and community integration for individuals with developmental disabilities. So these are just a couple examples. So there's Help Me Grow, which is a home visitation program for families with young children. There's the Technology First initiative, which aims to implement assistive technology. The Making Life Better initiative, which focuses on improving mental and physical health. And Employment First, which strives to place people in meaningful and appropriate employment opportunities. So now that we have a good idea of how DOD works and the different things that make up the system, we're going to look at the demographics of the individuals served by DODD. And today we're focusing on the rural and urban differences within this population. So here we see that DODD serves about 16,000 people in rural counties and about 78,000 people in urban counties. And so in this map, we use the U.S. Census data from 2010 to give rural and urban distinctions to each county. So here the rural counties are yellow and the urban counties are blue. And within each county, you see how many people are being served. So next, looking at some basic demographics, we saw no significant difference in the distribution of sex in rural and urban counties. So across the board, there's approximately 2-to-1 ratio of males to females within the DOD population. In terms of age, we saw that residents in rural areas tend to be older. So there was 4% less young adults in rural area and 1% more seniors and adults in rural areas. And in terms of race, rural individuals are more likely to be white and less likely to be Black, African American, or of other races. So in terms of living arrangements, we didn't really see any difference in the living arrangements of individuals in rural versus urban areas. Then looking at waiver utilization, so this is how many people served by DODD is on a waiver. And so we see a greater percentage of urban individuals are on a waiver compared to rural. And there's a few slight differences in the waiver type distribution. So we see slightly more IA waivers in urban and slightly more self and level ones in rural, but there's really not a big comparable difference. So we wanted to look at how these waiver allocations look like on the map. So this map shows the difference in waiver allocation by county, and again, the rural counties are yellow and the urban counties are blue. And so the shading of the brown dots here is the percentage of individuals served in that county with a waiver. And so the lightest color, what you see in like Erie County or Shelby County, are 20% or less, and the darkest ones, like in Guernsey County, are 60% or more.
We're sort of taking a little tour of a broad assortment of data that we have access to here at DODD, just because we had never really looked into urban-rural differences before, and we weren't sure what we would find. And so one of the other data sources we have is access to the Medicaid claims data. Around 85% of our people have a Medicaid card, and so it's reasonable to make assumptions when you have more than 85% of your population and you're able to look at it that way. Just so you know, before we get into this, we actually didn't find any statistical differences between urban and rural populations when it came to the cancer screening rates, but we definitely found some differences between the counties, and we wanted just to show the maps to you anyway because we thought it was sort of interesting, the differences there. As you can see here, so the map of the state of Ohio, the darker green is a higher screening rate, and the yellow is a lower screening rate. So this is for PAP testing in the past 3 years, and so it's only females at 18 years or older. So if you'll notice that in the general population of females who are 18 years or older, about 69% of women will have a PAP test. You'll see on this map Noble County there as 37%, and that's by far the darkest of any of them. Most of them are sort of in the teens as far as the PAP screening rate for the past 3 years. This is mammograms, so it's very similar information, but it's mammograms instead of cervical cancer screening. So, but this is, the population here is females and then 40 years or older. General population is 65% screening, and so that's what we would expect if our folks had similar screening rates as general population. And here in the upper left-hand corner is Williams County. That's 41%, and that's the highest screening rate that we found. There was not anything significant, and also when we talk about rural sort of all over and urban sort of all over. But if you think about Appalachia, sort of down there, you can see that in general, the folks down in Appalachia, it's a darker green color and sort of more consistent there. So I thought that was interesting. But even though it's darker, they're all in the 20s and not up in the 60s. And then colorectal cancer screening. So this is age 50 years or older. This one's a little bit different in the way that the data was collected. The general population data we have is specifically colonoscopy. And so it's ages 50 to 75 years. In the past 10 years, 62% of people in the general population have had a colonoscopy. Our data, the way that we needed to report it, it's the combination of colonoscopy, sigmoidoscopy, and fecal occult tests. And so it's a broader assortment of tests. So one would guess that it would be higher than the general population, right? Because you're throwing more different kinds of tests in. And honestly, it is better. Like Guernsey County they're at 66, which is higher than the general, but that's for 3 tests. But most of the sort of mid-range greens there, those are in the 30 ranges, and then the yellows are up in the 20s and the teens. And so that screening rate, even though this one is closer to the general population than the others, it's not quite as comparable, and also there's several different tests. So, changing topics yet again, I'm going to talk about the National Core Indicators data. National Core Indicators is a series of different surveys that are performed here in the state of Ohio and other states. Most of the states in the country participate in at least one of the National Core Indicator surveys. The 2 that Ohio participates in are what used to be called the Adult Consumer Survey. So if you've heard people say that, you're going to start hearing people say the Adult In-Person Interview. It's the same test or the same survey. It's just they've changed the name. And the other one that we participate in is the Staff Stability Survey. And Jocelyn will talk about that in a little bit. This year, for the National Core Indicators data, this will be, I believe, our 10th year participating. So we have a lot of data for a lot of years. The way it works is that 700 interviews are conducted across the state of Ohio. The people are randomly selected, and so they should be representative of the state of Ohio. if due to the randomness of the way it's selected. The people need to either be at least 18 years old, either receiving county board or ICF services. Some of the standard survey question areas are things like health and safety, wellness, rights, respect, community inclusion, access, choice, and choice is related to things like work, housing, daily activities. And so it really gives us a wealth of information into what the people we serve are perceiving as their sort of daily lives. So I wanted to show you, you already saw some of these percentages when Abby presented them, and that's out of our general population. And so what we wanted to do was look and see if truly our NCI survey people that we got in our population were comparable demographically as far as urban and rural goes to our general population. And so you can see here that, this is 19% of how many people participated in, so this is rural and this is urban. I'm not sure why some of the stuff isn't showing, it's on my slide, it's funny. In the general population, whereas this is 19%, we have 17%, so it's very, very close. As far as age distribution goes, we expected to see a slightly larger number of these gray ones on the top, the 65 and older, because in the rural area, because that's what we saw in the general population. And in fact, that's what we do see here, 12% of 65 and older in the rural population versus 8 in the urban. The differences are not significant, but we were just sort of looking for trends and patterns just to see if it seems comparable. Now we're going to talk about race, and as Abby mentioned, in the rural area, in the general population, we see general population of the DD folks as opposed to the sample. We see a larger number of white people in the rural area, and in the urban area, there were 21% of African American versus I think it's 4% in rural, and this is in our survey, which is pretty much what we expected to see. Living arrangement, this is the only one that actually ended up being a little bit different. If you remember when Abby showed you that slide of living arrangement, there were the two bars going across, and they were basically identical. But living arrangement, according to NCI, is not identical at all. The populations are similar to the general DoD, but they're laid out a little bit differently. You can see here the rural population here. This 18% is representing group home, which is one of the NCI categories. If you come over here to urban, you can see that little tiny sliver there. That's only 2%. So that's quite a big difference there. This is statistically significant using Fisher's exact test. As far as owning their own home, 29 versus 22, and parent-relative home, 37 versus 44. So it looks like in the urban area, this living at home is sort of taking up what might be coming split across all of these. So now that we have seen that the populations are generally pretty similar and that we did a pretty good job of getting a random sample for the state of Ohio, we wanted to look a little bit at the health conditions to see if we compared urban to rural populations, if we would find any statistically significant health differences. These questions here are not asked of the person being interviewed. They are asked of the service coordinator. And so, just so you know that that's what the data source is. We found really a whole lot of nothing if you're comparing the urban and the rural as far as it being statistically significant. So we have a variety of health conditions. Here's the percentage of people in rural areas reporting. Here are the percentage of people in urban reporting. Just to point out a couple of things, autism and CP look a little bit higher in urban areas. Seizure disorder, vision impairment, Alzheimer's look a little bit more common in the rural areas. We did notice that the population was a little bit older in the rural area, so that might be related specifically to the Alzheimer's and the vision being higher rates. But once again, you can see the p-value greater than 0.05. This is not statistically significant. It's just information to know. I would like to point out, and so this is something that for healthcare providers to know, is I think there's a lot of focus sometimes on someone's disability as being their health issue. And if you look at this page, and then let me flip on to the next one, which is fairly similar but with different diagnoses. Even though people have an intellectual disability or developmental disability, they may also have other physical health problems, and that those rates are comparable to the general population. And so if someone has a disability and they're coming in for treatment, then you should give them a physical the same way you would someone else, not assuming that they would not be having some other kind of health issue. But just to look through these a little bit more, once again, not statistically significant between urban and rural, but if we wanted to look a little bit for trends, you can see that in the rural area, cardiovascular disease and diabetes are both about 5% higher than urban. And the only thing that's higher in urban, and you see all of these are lower or the same, is this other health conditions. And the way that question works in the survey is basically they ask if someone has any other health conditions, and they mark that as yes, and then there's a text box and they can kind of type in. So it's all different kinds of stuff mixed together. But it is interesting that how much higher that is in the urban area. Not statistically significant, but interesting. And then just one more slide coming from the NCI data of the interviews. I know that we talk a lot and we worry a lot about people having a primary care doctor, and according to the folks who completed these interviews, nearly everyone reported that they did in fact have someone that they would consider to be their primary care doctor, and that the percentages were identical, like not like similar, but identical in urban and rural areas. And so I thought that was just sort of worth pointing out. And that is it for the regular NCI survey data. I'm going to turn this over to Jocelyn, who will now talk about our staff stability data.
So I hope already mentioned that NCI conducts these national surveys, and she talked a lot about the adult in-person survey. So now I'm going to focus on the staff stability survey. So again, this is a national survey, and the goal of this survey is to really get reliable data on staff turnover rates, wages, benefits, and retention policies. And so they kind of are doing this and collecting this database of information as a way to aim to reduce costs associated with turnover, and also reduce the impact of turnover on the individuals we serve in terms of the quality of the supports that they receive. And so we're going to look at some of the results of the 2016 Staff Stability Survey. And in that, we saw that there was a 51% annual turnover rate. And now this was, Ohio was very close to the NCI national average at about 46%, which is the average across the United States. And so it's kind of showing that there is a trend across the U.S. that there's a pretty high turnover rate in terms of the direct support professionals. And they also looked at when these DSPs do leave, how soon into their employment do they leave. And it looks like under 6 months of being employed is the most common, so about half the DSPs left with under 6 months of employment, 21% at 6 to 12 months, and then 31% of those who did leave at over 12 months. So this means that providers do have to start from the beginning training new people pretty frequently if they're having less than 6 months of time on the job. And this slide, for some reason we lost all of the words, but we still have the pie chart, so that's the most important part. So this pie chart is showing the Ohio Provider Agency full-time vacancies. So the 19,811, which is the biggest gray chunk of the pie chart, are the number of filled full-time DSP positions. And the red wedge there is 1,896 vacant full-time DSP job opportunities. So that means at any given time, we need around 22,000 direct support professionals to support the population we currently have in Ohio. And so that means 8.7% of those positions are actually open. And so some of the consequences of that are a lot of overtime services seen with the current staff and a lot of burnout, which could contribute to some of the turnover rates we've seen. And something else to consider is that although Ohio is right at the national average pretty much across the board in terms of wages and benefits, there are still a lot of provider agencies that do not have a paid time off, bank, health insurance, or sort of a career ladder leading to higher opportunities within the field. And so that's something else that could also be contributing. So we seem to have some sort of supply and demand factors kind of in competition with each other. So how are we going to increase our supply of direct support professionals and even on the flip side, decrease the demand so we can kind of even out this workforce? And to do that, there are several benefits and training for support staff retention and then also complementary services to help alleviate staff demand. And we're going to go into each of these resources in more detail. So the competency-based training and longevity add-on, which I'm just going to call the competency add-on to make it a little easier, that was effective as of July 1st of this year. So it's a fairly new add-on. And this means that the state reimburses providers an additional 39 cents per 15-minute billing unit, and that equates $1.56 per hour. But in order to get this extra or additional reimbursement, they have to have at least 2 years of experience with state or county funded DD services, and then also at least 60 hours of applicable training. So this is really an incentive for DSPs to stay in the workforce a little bit longer, work up to that 2 years of experience, and get this added benefit in terms of an additional amount per hour. And so that helps with kind of the supply issue and encouraging longevity in the workforce. And then there's also the Employer Resource Network. This is something that is nationwide, but there's an Ohio-focused network, and it is a collaborative effort across the state. It has both public and private collaborators, and they're really working to improve retention of this DSP workforce through support and training. So they help improve the employee skills, they prepare employees for advancements, and then they also do training on things for like computer training, budgeting, problem solving, and leadership training for these direct support professionals, and also agency and organizational management. So it's kind of a support to help improve both the employees and the organizations. And one of their main training models that they use is called Bridges Out of Poverty. This is specifically a workshop for managers, and it's a one-day interactive seminar. And in Ohio, 14.6% of Ohioans are considered to be living in poverty, and that's actually higher than the 14% average across the United States. So chances are a lot of the future employees or interviewing individuals for these positions could be considered to be living in poverty. So this really helps managers get a better awareness and understanding of kind of where this population is coming from, and it helps them get some training to learn how to build relationships with individuals in this situation, how to help them with problem solving, and work to get them moving from welfare to more stable long-term work. So both encourages employee retention and also works to get an underserved population into the workforce. And so another section that we really needed to work on is the demand that we have for DSPs. 22,000 seems to be a really high number for the workforce needed for our population. And so one way to kind of mitigate that is with remote support or monitoring. And so this uses supportive technologies to help individuals accomplish tasks in their own home or else provide care from a distance. And this is done through assistive technology such as an iPad or an Alexa or some other form of technology that can help an individual improve upon their functional capabilities or maintain their functional capabilities with communication apps or being able to use voice commands to use phone calls or turning things on and off in their home. So kind of a way to help them be more independent. And then there's also remote monitoring, which uses sensors, cameras, and FaceTime technology to have direct support professionals that are off-site work with individuals in their homes and provide support remotely.
Meet Brad. Brad likes soccer and hanging out with friends. He also has a developmental disability. That means different things for different people. But for Brad, it means that he sometimes has seizures and has trouble remembering things. He uses tools, like lists and calendars, to help keep him on track. Brad also has a family that loves him a lot. When Brad told them he was ready to live on his own, they wanted to support him, and they were concerned about his health and safety. The service and support coordinator that helps Brad coordinate his services through his County Board of Developmental Disabilities talked to Brad about remote monitoring. Remote monitoring is a Medicaid-funded waiver service that uses technology to promote a person's independence and safety by having staff in a remote location. There are a lot of different tools available through remote monitoring. Things like sensors that trigger alarms, as well as door cameras and monitors. Remote monitoring tools can be customized to best fit someone's needs, no matter their age or their disability. Brad needed a tool that could help him if he had a seizure while he was home alone. He uses sensors installed in floor mats to help detect if his movements become irregular, and can alert someone remotely of a possible problem. He needed a tool to help him when he forgets things like taking medicine or turning the water off after using the sink. So his sink has a flood detector that shuts off the water if Brad forgets to do it. He also uses a medication dispenser that alerts him if he hasn't taken his pills. It can even send his family a text message if he misses it a second time. The remote monitoring tools Brad uses every day support him in being more independent in his daily routine and help him live on his own. The tools put his family at ease because they know he is safe. They also know that they will get an alert if something goes wrong. Brad now gets to live more of the life he wants. Thanks for watching.
So that was a really nice overview of remote supports and remote monitoring. And so with that, we wanted to see if there was any difference between rural and urban counties in terms of utilization of this remote monitoring service. So overall in the bar graph, you can see that the numbers are pretty close in terms of the number of users per 1,000 waiver participants. So 5 people per 1,000 in the rural and 6 people per 1,000 in the urban of waiver participants are utilizing this service. And so as of fiscal year 18, we had about 215 users, and now already on the amount authorized for fiscal year 19, it's around 300 users. And so while they're pretty similar in the aggregate numbers, you can see on the map with the counties that there are some distinct differences. The darker the green, the higher number of waiver participants that are utilizing this service. So you can see that some counties are really adopting this feature, like Williams is at about 38, Paulding is at 36, Seneca is at 43, Wyandott's 51, while some counties haven't adopted this at all. So it's kind of a good way to see that while rural and urban may look similar, there are quite a few differences within the counties. And so another program in place to help with this kind of demand for DSPs is the Ohio Shared Living Program. This shared living program is an option for individuals with an IO waiver, and unlike adult family living or adult foster care, this program can apply whether or not the caregiver is related to the person. And so this is something that we hear from providers in rural areas that because of the long drive time, it's kind of harder to get to some of the people they're serving or to get to more individuals. And in this program, they could actually have the opportunity to live with the individuals that they serve and have an in-home caregiver service. And so it kind of allows for a more stable, familiar home environment. And again, caregivers can be family or friends, roommates, or staff members. And so within Ohio, we again looked at rural versus urban. And we saw that, again, in the aggregate, it was pretty much the same across the board. About 73 users per 1,000 waiver participants are utilizing this Ohio Shared Living Program. And again, this data is from fiscal year 18. But when you look at it on a map by county, there's definitely some pockets of darker green areas that pop out, such as Noble, Monroe, and Morgan have 200 to over 300 participants per 1,000 waiver participants in this program. And then Williams, Defiance, and Paulding in the northwest corner have 150 to 200 participants. So again, between counties, there seems to be very much of a difference in utilization of these different programs. So with that, we have given you a lot of information, an overview of DODD in general, some information on cancer screening rates between rural and urban, and then also a lot of information on NCI and the programs we're using with the staff stability DSP information.